Welcome to Your Health is Wealth, giving you the keys to unlocking better health naturally. Today you'll learn about how to bank wisdom for a richer, fuller life. Your hosts are Dr. Stephen Katz, an award-winning naturopathic physician and former president of the Arizona Naturopathic Medical Association. Dr. Loreena Ryder, a naturopathic physician and current board member of the Arizona Naturopathic Medical Association. And Dr. Hannah Lindsay, naturopathic physician and former board member of the Arizona Naturopathic Medical Association.
Hi, and welcome to Your Health is Wealth. I'm your host, Dr. Loreena Ryder, alongside my co-host, Dr. Hannah Lindsay. Every Friday, we talk about health and provide practical health tips that you can use to help you achieve a better quality of life. If you're struggling with your health, give us a call at Naturopathic Physicians Group.
Hello, everyone. This is Dr. Lindsay. Every single week, we like to start off by telling you a little bit about what is a naturopathic physician. So a naturopathic physician can provide primary care as well as specialized care. We look at the body as a whole and determine the root cause of your symptoms. So instead of just treating your symptoms or what is presenting in your body, we actually find the cause and then treat the cause. So our first appointment with you usually runs about 1 hour. We believe that prevention is the best form of cure. So we like to help you get better and stay better and prevent diseases from appearing in your life later on. And we also like to improve your quality of life.
Every week we have a different topic of the day, and this week I think it's going to end up being a very popular topic. It is weight management. Most people are out there trying to maintain their weight, lose weight. Few people are trying to gain weight, but we're trying to summarize this up. It's geared more toward weight loss, and some of the symptoms that you may experience are pretty self-explanatory. You'll notice the scale increasing whenever you step on it. If you aren't stepping on a scale every day, you'll notice how your clothes are fitting a little bit differently. And most people are having a tough time losing that weight. And that's where they will come to see us or any physician and to get some assistance on losing that weight.
Right. Having those pounds that you just cannot seem to get off. It's such a common thing that we see, especially in this country. And even if you're not trying to actively lose weight right now, just the society we live in is so geared towards losing weight, being your fittest self, the body image. It's all just impacted by the society we're in. But some of the other things you may experience with an increased weight or inability to lose weight, you might feel fatigued, you might have some brain fog. It could be a part of a metabolic syndrome, which would be increased blood pressure, high glucose, insulin resistance, excess waist and body fat, as well as high cholesterol or triglycerides. This typically presents as an apple or pear-shaped body.
Mm-hmm. And if you're not really sure what that is, you just picture an apple. An apple is heavier at the top and smaller at the bottom. These are people that carry their weight at their chest and upper back area. And the pear-shaped body are the people who carry their weight at the hips and lower abdomen area. That's pretty typical of metabolic syndrome.
Yeah, sometimes it's referred to as visceral fat as well when it's around the organs in the abdomen. That can cause the abdomen to expand even if the limbs aren't also growing at the same speed. So it causes that kind of shape that we're talking about.
Yeah, heavy in the middle and kind of thinner on the outsides, like at the arms and legs. You might also experience some decreased endurance. You just can't do as much as you used to do. Climbing a flight of stairs is just a chore for you now, where you used to be able to trot up no problem. You might also experience some joint pain. Excess weight puts additional stress on our joints, especially the knees, but also the back and feet. The inflammation from excess weight will also cause joint swelling and pain. So that seems to be a major complaint for people who are overweight.
Yeah, if you have joint pain, especially in your knees, those weight-bearing joints, losing weight can be a great way to treat it. It can be part of the treatment. So that could definitely be contributing to your joint pain. Heavy breathing as well. If you get winded walking up the stairs or doing regular daily activities, there's something called obesity hypoventilation syndrome, also known as Pickwickian syndrome. Did I say that one correct?
I think so.
Pickwickian. It's kind of a fun word, but not a fun thing to experience, feeling like you can't catch your breath. Also, it could come along with sleep apnea. A lot of times sleep apnea will actually resolve with weight loss. So this is when you're sleeping and you're not able to get breath as you're sleeping. It may appear as you stop breathing at night. It could just be disruptions in your breathing, but that could be potentially caused by an excess weight.
And people who are using those CPAP machines that have sleep apnea, I'm sure they would love to get rid of those devices.
Yeah, I'm sure they're not fun to wear at night.
Some of the causes of weight gain, a lot of people think that food intake is the only factor. You're eating too much. Well, there are a lot of people who are just eating the wrong type of food, and we'll talk about that moving forward. And also, I think everybody knows just having a general sedentary lifestyle and lack of physical exercise, that will definitely contribute to weight gain.
Yeah, eating the wrong foods, not exercising enough, almost everyone knows that's going to contribute to weight gain, or you'll have difficulty losing weight. However, that is not the only cause. And I think that this can be frustrating for people that eat really clean or are exercising and they're still unable to lose weight. So some of those other causes, it could be stress related. Cortisol can make us hold on to weight if we have chronic high levels of cortisol. It could be lack of sleep. We need restorative sleep for our body to operate properly and use fat to burn fat. It also could be a hormone imbalance. There's a few different conditions like PCOS, estrogen dominance in general, post-pregnancy, perimenopause or menopause, or like I mentioned, that excess cortisol. These hormonal imbalances can make it really difficult to lose weight and can cause us to hold on to that excess weight.
A lot of patients who come into the office, they'll say, I just can't lose weight. I think it's hormones.
Yeah.
It very well may be, but we want to check off the major contributing factors like the food and the physical exercise first. But hormones definitely can play a role in that, especially for the perimenopause and menopause age women. That's a big thing for them. Also, speaking of hormones, thyroid hormone imbalance. Like that's a big thing as well. So you have what you were talking about earlier, the sex steroid hormones like estrogen, progesterone, testosterone, those types. But also the thyroid hormone imbalance can look like a condition called Cushing's syndrome. Cushing's syndrome body type shows up with that fat pack that's at the back of the neck. They call it a buffalo hump. And then also abdominal weight, but those skinny arms and legs like we were talking about with metabolic syndrome. So that's a picture of Cushing's syndrome.
Yeah, Cushing's syndrome is actually a condition of that excess cortisol like we talked about. So that can be in conjunction with a thyroid hormone imbalance. Very often the thyroid is affected by your stress as well. But a lot of people are familiar with hypothyroidism, or the autoimmune form of hypothyroidism is Hashimoto's thyroiditis. So this is when your thyroid hormones are low, and your thyroid does a lot in terms of your metabolism. So if your thyroid hormones are low, that's going to drop your metabolism as well. It'll make it really difficult for you to lose weight if your metabolism is not operating properly.
Hashimoto's is another thyroid autoimmune condition that can cause weight gain for sure. Also, just having a toxic body environment. Now, that doesn't mean you're walking around glowing or oozing green goo or anything, but we have toxins in our body that need to come out. Also, nutrient deficiencies, and everybody knows that diabetes can cause you to gain weight as well.
Yeah, absolutely. Having the high levels of sugar in your blood can absolutely contribute to weight gain and difficulty losing weight. Well, a lot of people refer to BMI or body mass index in terms of underweight, normal weight, and overweight. We'll get into that a little bit. So thank you for tuning in to Your Health is Wealth. So every week we do a segment called What Isn't Your Doctor Telling You? So this is not to slam any doctors out there. A lot of times they just don't have enough time with you to tell you everything that you guys need to discuss. So that's something we really try to do as naturopathic physicians, is have enough time with you to talk about everything. And we really love to educate our patients as well. We believe that doctors should be a teacher. And ideally, you'll walk out knowing more about your body than I do, because we want to become partners in your health with you. So in terms of weight loss, something that you may not know is that eating less may not always be the best option. There are a lot of healthcare professionals, nutritionists, dietitians, XYZ out there that insist on this idea that calories in need to be less than calories out in order to lose weight. So you need to be burning more calories than you're consuming. This may not always be the case. It may be true in a healthy individual whose metabolism is working as it should. However, if there's a certain cause to your inability to lose weight, like a hormonal imbalance, for example, this could actually harm you more than help you. For example, if your difficulty losing weight is related to low thyroid function or low thyroid hormones, it may actually be better to eat more regularly, eating smaller meals more regularly in order to avoid stressing the thyroid. This is why it's so vital to be treated as an individual, because your individual journey to weight loss is going to look so different than anyone else's.
Right. Let's talk about some traditional diagnostic tests that will be done. If you go to a typical medical doctor, they'll probably run your blood work, a CBC, which checks your red and white blood cells. They'll check your metabolic panel to make sure your liver and kidneys are working properly. Insulin is a pretty popular test, as well as your hemoglobin A1C to check for insulin resistance. They'll check your cholesterol and your triglycerides. May possibly check thyroid. I don't typically see female or male hormone panels run whenever someone is having trouble lose weight. That's kind of a last resort for traditional doctor. But I do see sometimes they'll run cortisol and ACTH to make sure that you don't have anything going on adrenally, like that would relate to that Cushing's syndrome.
Right. And usually when they're running thyroid tests, it's typically only TSH, thyroid stimulating hormone, which really is not giving you any information about what's truly going on with your thyroid. And oftentimes I've had patients where their TSH will be elevated, but they still view it as a subclinical. So they don't even care to look at the T3 and the T4, which are the actual thyroid hormones. And that's going to give us way more insight to the symptoms you're presenting with and how you're actually feeling. So if you're just getting TSH checked on your thyroid, that is not enough.
It's missing a whole lot of the big picture. Yeah.
Right.
So some of the traditional treatments that you might experience whenever you go to traditional medical doctor for weight loss would be appetite suppressant medications. They're pretty popular. They do come with side effects, though, just keep that in mind. But one of them would be liraglutide or Saxenda. Basically, this tells your brain that your stomach is full. Pretty convenient. This is a higher dose of the diabetes medication Victoza. Maybe you've heard of it, maybe you haven't. Naltrexone, HCl, and bupropion combo called Contrave. That's another popular weight loss medication. They're approved separately, one to treat alcohol and opioid dependence, and the other one to treat depression, smoking cessation. But apparently now they're used to treat weight loss.
Yeah, I've seen that one actually quite a lot, the low-dose naltrexone Wellbutrin combo. Orlistat is another medication that may be used. This one, I feel like I've seen some of those commercials, those pharmaceutical commercials for this one. Orlistat. So blocks fat absorption in your body from the food you eat. So that sounds great, right? But we need fat. We need fat in our body. And sometimes we're eating healthy fats. So you don't always want to block the fat that you're consuming. It's kind of a Band-Aid. It's not truly treating anything.
And if you're blocking the fat, it's coming out whole. So you likely have some GI issues of having like greasy stools and stomach cramping and so on and so forth.
Oh, I'm sure. Yeah. Phentermine is another one. This one's used to curb your appetite, and it's sometimes used in combo with another drug called topiramate. Topiramate is a seizure and migraine medication, but it's sometimes in combo with phentermine to curb your appetite as well. So, a lot of these drugs have other pathways that they're affecting, so you can imagine the side effects.
Right. Semaglutide or Wegovy is another medication that's used. It decreases your appetite, helps you feel full. This drug was originally approved to treat type 2 diabetes because it stimulates insulin production, but now it's used in treating obesity. So like I said before, obviously there are side effects from every single drug. I don't know a drug that doesn't have a side effect. So that isn't something that we recommend, but I just wanted to give that information to you.
So there are also surgical corrections to try and help individuals lose weight. There's bariatric surgery. This is modifying the size of your stomach. There's also gastric bypass surgery. So this is where the stomach is surgically cut. There's a small upper pouch that is now your new stomach. So again, just shrinking your stomach. So the lower stomach remnant and the small intestine are then connected. So you're kind of bypassing a large portion of your stomach, and you can't eat as much if your stomach is smaller. So
invasive.
Very invasive. I mean, let us try a few other things first before you go to this route. And of course, there are some patients that are significantly overweight, and this may be the best option for because they may have other risk factors going on, but there are so many other things that you can try before jumping to something this invasive.
Right. And something that's really similar is called the sleeve gastrectomy. That's also where the stomach is surgically cut and the larger portion of the stomach is actually removed. It's completely removed from the body. So what's left is a sleeve. So basically it's a smaller portion of the stomach as well. This one looks more like a tube than a pouch. Now, these surgical procedures, they bypass or they remove a large portion of your stomach, both of these. So our bodies, I've always thought about it this way. We have organs for a reason. To take them out just kind of makes me nervous. Removing them can be detrimental to the rest of the body as a whole. But I'm not saying these procedures don't work, because ask anybody that's had them, and I would say probably 80% of them are like, oh yeah, I used to be a lot heavier than I am now, and it worked. Yes, it definitely works. However, later on in life, most people are left with other symptoms. Like the stomach contains parietal cells. They help the B12 production. That's where that comes from. They also do some other hormone production. A large part of our mitochondria, like a huge part of the mitochondria, are made in the parietal cells. That's energy production. So if we take out our stomach, then our bodies can't produce that anymore. So just a few examples of that.
Yeah, our bodies are made so intricately, and we're holistic beings where all of our organs work together. So anytime you take anything out, you're not just going to return right to balance right after. It's going to be a process. And even with, for example, gallbladder, I see gallbladders taken out left and right, and they're just like, go on your way, like nothing's changed. Something significant has changed, and there's things you can do. You need to address that after the fact, because if you remove a digestive organ, your digestion will be affected.
Yeah, I've heard them say, well, they told me it doesn't really do anything anyway.
We're laughing because we know there's so much that it does. So much. So there's also another option that is a little less invasive. So it's called a gastric band surgery. This one is actually an adjustable, and it's a reversible procedure. There's no cutting of the stomach. It's just a band that's placed around the stomach, and it reduces your stomach capacity. So it can also slow the passage of food through your stomach. So the idea is to retrain your brain and your body to eat less.
If I were to opt for any of those, that would be the one, because at least you still have your stomach.
Right. If you're really itching for a surgery, that would be the best one. But again, there's so many other things. And I feel like, again, looking at these as Band-Aids, there may be some relationship that what you have with food, some form of disordered eating. And if you don't address that, then making your stomach smaller isn't actually going to fix your relationship with food. So there's a lot of things we need to do, not just on the physical wavelength of losing weight, but it's so mental and emotional too. We kind of have, it's so important to treat the cause from every aspect.
I know I've said this before, but food is our very most intimate relationship. It's very personal. Our choices that we make, it gives us certain feelings. Comfort food, that word isn't there just for no reason. Food provides comfort to most of us.
Right. And I never think, of course, there's situations where there's things you have to cut out, things that we test for XYZ, but you should never hate your relationship with food. I think that's so important. If you despise what you're eating and you're miserable, I don't think there's anything healthy about that. So we always try to work with our patients. We want you to love your diet, and we want you to love a healthy diet, and we believe that's possible.
Agreed. a few of the naturopathic testing that we do is pretty much the same as the Western medicine. We check your blood. We talked about the hormone panels and the thyroid panels and checking your red and white blood cells and your liver function and all that. But one thing that we do differently is test food sensitivities and food allergies. That's huge. Every week, we like to give a tip of the week, something that you can take from our show and use at home in order to improve your health. This tip of the week is skipping dinner. Sounds crazy, but let me walk you through it a little bit. So intermittent fasting, it's become more common over the recent years. I'm sure you've heard those buzzwords flying around. And it's something healthy and feasible that you can do to reduce weight. Have you ever done intermittent fasting?
Yeah, I used to intermittent fast a lot. I actually would skip breakfast, though, and eat later in the day. But I have looked at the research on the differences between skipping breakfast versus dinner.
Mm-hmm. Yeah, so most common is the skipping breakfast. And it's pretty easy because, right, you're rushed around in the morning anyway. And so not having to make yourself some breakfast, it's kind of adds a little bit of time. So most of us can do that pretty easily. But if you've never tried to go without eating dinner, I found this to be very effective when it comes to weight loss. So what you should do is eat the majority of your calories earlier in the day. Basically, you're trying to just bulk up earlier in the day so that you're not starving by dinner time. Eat a healthy breakfast, whatever that looks like. Eat a hearty lunch. You can even eat a late lunch if this helps, but eat nothing after 6 p.m. So make sure that you're doing some time management throughout the daytime and make that hard, fast cutoff at 6 p.m. Now, if you're extremely hungry after 6 p.m., then grab a handful of berries or a cup of miso soup, something that's not going to really load you down, but will just get you through till bedtime. Try this for maybe 3 days or a full week if you can. If you feel good and you have a notable difference, add this to your regimen of intermittent fasting. Now, some people do intermittent fasting a little bit differently. Some people will skip lunch 3 days a week, or, there's so many different variabilities. They will eat between noon and 8 p.m. every day and just keep food consumption to those hours. But this is one more way that you can add in that intermittent fasting. You don't have to continue this on your regular routine forever. I don't want you to miss out on a nice dinner with friends or family or that celebratory dinner with everyone. But when time allows in your personal schedule, just try skipping dinner, at least no snacks after dinner.
You can also ease yourself into it a little bit. If you have a goal of only eating between 10 and 5, for example, you can start by eating 8 to 6 and then make it 9 to 6 and then make it 9 to 5 and then 10 to 5. Take it easy. Wait till you have a period that feels good and you don't feel like you're starving yourself, and then get to the window that works for you.
I think this might be kind of a big deal here in America because we view dinner as like the biggest and the main meal of the day. Mm-hmm. I don't think that's the case all the way across the globe. I think in some cultures, lunch is that largest meal of the day. And I've seen it be very effective.
Yeah, especially because very often we're eating this huge meal at night and then being sedentary for the rest of the night before going to bed. If you eat earlier in the day, you have more time where you're up walking around, being a little active. Your body's able to process some of that food before you lay down and go to bed at night. So it makes a really big difference. Mm-hmm. So we're going to jump into some naturopathic treatment options, best part of the show. So first and foremost, like we said, we always want to treat the cause. What is the cause of your inability to lose weight? Like we said, diet and exercise, we're going to get into a lot of details about that, and that's going to be the first thing we do. However, when we run labs, if there's a hormonal imbalance that comes back, if there's thyroid imbalance that comes back, if it's showing that you have high cholesterol or insulin resistance or any of these other things we've talked about, we want to treat those things. We want to correct those imbalances, because once we get your body working and in balance and in the way it should, then the diet and exercise will work so much better. The weight should really fall off. And then these other treatments that we're talking about will work in conjunction with that.
And there's a right way and a wrong way to test for hormone imbalance. Like for females, because we cycle, there is an optimal time during your cycle to check your hormones. And it varies according to which test you want to run and how old the patient is, whether they're premenopause or postmenopause, but it actually does matter.
Right. So if your doctor isn't telling you to come back for lab testing at a certain day in your cycle, that should be a little bit of a red flag for hormonal testing specifically. It should be timed within your cycle accordingly.
Right. Let's talk about diet, everybody's favorite, right? So we talked earlier about naturopathic doctors will likely test for food sensitivities and food allergies. Now, they are different immunoglobulins. It's a simple blood draw. You don't have to be fasting for it, but you really want to follow what your results are. Some people will come in and they'll look at their food panel and they'll take it home and they'll just be like, it's knowledge that I have, but I'm not following it. But you really actually have to follow what the test says. You do need to eliminate the foods that are causing the inflammation and causing you grief and causing you bowel disruptions. And sometimes that takes some coaching to get through those food panels. It can be grieving for some people to go through that.
Because food can be emotional and personal and intimate. And so, yeah, we do our best to coach you through that, but it can make a huge difference cutting out those inflammatory foods, not just with weight loss, but with just about every topic we've talked about on this show. Mm-hmm. So also when you're eating, it's super important to practice mindful eating. This is something we talked about a lot in our stress management mindfulness courses. But when you're eating, it is so one of the worst things about our food culture in America is we're grabbing food, we're eating it while we're driving, we're eating it while we're on the phone, we're eating it while we're doing 100 other things. When is the last time you sat down and with a plate in front of you and all you did was eat? And that doesn't mean you can't socialize. There's actually a lot of research that shows digestion improves when eating with other people and being social. But distracting yourself while you're eating, watching TV,
being on your phone,
all of these things, it impacts the way that you are digesting your food. So you want to eat slowly. You want to taste every bite. You want to chew every bite multiple times, even upwards of 20 times, chew each bite. It can make a huge difference. Your digestion starts in your mouth. Your saliva has enzymes that begins breaking down food. So if you're swallowing your food whole, you're missing out on the beginning of your digestive process.
Plus you might choke. That's bad.
Well, yeah. Just don't swallow your food whole, please. But also this kind of comes in hand with portion control, because when you're eating slower, you're more mindful in your body. You can feel when you're actually full and when you're ready to be done eating. So that's huge, just the portion control aspect of that too.
And don't forget water. Aim to drink, well, let's give a number of 80 to 100 ounces of water every day, but this is variable. So half of your ideal body weight in ounces is the perfect number for you. Also, fiber is really great because fiber helps push what you eat out the other end, right? So 125 grams of fiber-rich carbohydrates every day is going to be really great. These are things like quinoa, brown rice, sweet potatoes, beans, raspberries, strawberries, and lentils.
Aiming for high protein every day, about 85 grams. You know, these aren't specific measurements. It's going to depend on who you are, just general recommendations. Eating protein can be great for you, but you want it to be lean, clean protein, like skinless chicken, lean red meats, ones that end in round or loin, fish, seafood, quinoa, lentils. Again, it can be so individualized based on food sensitivities, but these are just some ideas. Your most carbohydrate-rich meal should come right after strength training or exercises. That's when your body is most ready to absorb carbohydrates and utilize them rather than just storing them as fat.
And alcohol, none is best. If you are going to have an alcoholic drink, just drink one alcoholic drink per week. And vegetables, look at your plate, make half of your plate vegetables, and the other half, divide that between protein and healthy carbs. Let's talk now about exercise. A rule of thumb would be 30 minutes per day, 5 days per week minimum. Obviously, you can do more than that. That would give you better results unless you're doing too much, but that's a nice rule of thumb. Also, it's a good thing to incorporate yoga or meditation into your practice. And I really want you to enjoy your physical activity. Maybe sign up for a pickleball experience, which I recently did. I'm so excited. You can attend a Zumba class. That's dancing, but exercise dancing, if you don't know what Zumba is. Get some friends to do whatever your interests are with you so that you have some accountability and also have fun at the same time.
Yeah, this is huge. Be active, eat clean. These are the foundational basics when it comes to losing weight. There are also some supplements you can try and take to support your weight loss. Alpha lipoic acid is a great one. This can actually help to curb your appetite. It's an amazing nutrient. It can be taken orally or intravenously through IV therapy. That's a great one to have in your back pocket.
Chromium picolinate. This is a supplement that's a lot of times used in diabetes patients. But this enhances insulin, it decreases your appetite and your body fat, and it boosts muscle mass, which is a nice little bonus there.
Green tea extract, or even just drinking green tea, this can also help to curb your appetite and even increase your metabolism. But green tea has so many other benefits, so it's not going to hurt you.
Right. And just make sure it's unsweetened if you're drinking that green tea. It can be hot or cold.
Please don't put like 3 pounds of sugar in your green tea. That takes away the fun.
Right. Amino acids are great supplements. A lot of times these are found in protein shakes. Try not to use whey protein because that's inflammatory, that's milk-based. But amino acids are the building blocks for proteins in our bodies, and so that's why it helps decrease fat and build muscle.
B vitamins, we talk about them a lot, but they are useful for just about everything. They are going to help enhance energy and enhance weight loss. So they're part of a lot of systems in our body that are important to be functioning well in order to lose weight.
Fish oil will help curb your appetite and hunger as well. Fish oil is pretty much great for everything, including thinning your blood. So if you're about to have a surgery, you don't want to have fish oil before that. And then also ginger. It increases fat burning, which is the technical term for that is thermogenesis. But you want thermogenesis inside your body to process things and get that fat burning.
Yeah, ginger's great for digestion too. And just remember, as we're giving these ideas and treatments, it's never telling you to take something or not take something. We're just throwing recommendations out there. We always want you to consult your physician before changing any supplement regime that you're on. There's something called MIC injections. MIC stands for methionine and inositol choline. Some B vitamins are usually added to the formula as well, but these are liver-supporting compounds that help to break down fat. So it actually metabolizes fat cells and helps eliminate stored fat. So you can do these injections 1 to 2 times per week, along with a diet that you and your healthcare provider have decided upon. And results will usually take about 3 to 4 weeks to begin to see. But of course, this is going to depend on how faithful you are to your exercise and diet routines. This is not a replacement. It is in conjunction with a healthy diet and exercise.
HCG is another way to lose weight. I don't know if you've heard this around lately, but it's HCG stands for human chorionic gonadotropin. And yes, it's the pregnancy hormone. It's super high during the first trimester of pregnancy, but it actually helps you lose weight. Now, this is not for the meek at heart because HCG is an extreme caloric restriction diet. It was founded by Dr. Simeons. He has books out there. He has products on the web that you can look up. But Dr. Simeons noticed that patients could drastically reduce their caloric intake without experiencing irritability, hunger pains, headaches, or weakness. I know, hard to believe, but basically the HCG diet is a 500 calorie per day intake with restrictions on oils and fats. Now, I did this myself because I don't like to put my patients through something that I don't know what it's like to experience. But you do 1 injection per day administered by yourself. This does not hurt because it goes in the fatty part that you're trying to get rid of, typically the abdomen. You have loading days where you can eat whatever you want, however much you want. Those are 2 days at the beginning. Those are the most fun.
I'm sure.
Out of all of this. And then you do about 3 weeks where you only eat foods on a specific list. You absolutely cannot cheat or this will not work. And you lose about half a pound to a full pound per day. And this actually also reshapes your body. The results are quite incredible if you can endure the whole 3 weeks.
Yeah, the results from HCG is pretty amazing. And we get to see a lot of patients doing that and achieving the results they want to see. But we also try to work with our patients so that the second these 3 weeks are over, they don't jump back to the diet they were eating before. We usually are running food sensitivity panels as well, helping them reintroduce a healthy diet to maintain the weight that they lost. That's a huge part of it as well.
Right. I do have to admit, though, it says that you don't experience hunger pains. I was hungry. I was pretty irritable and I was hungry during this. But if you can be okay feeling hungry, this really does work. But I did notice some really phenomenal things throughout this HCG. And this was probably, 6 months ago that I did this. But I have tinnitus, which is ringing in the ears. I noticed that completely went away. And I'm wondering if it was maybe an inflammation reducer because I was barely getting any oils, any fats, and absolutely no food that I was sensitive to.
Right. It's a very clean diet, so it can definitely cut down on that inflammation.
Mm-hmm.
Food is so powerful if you do it right. Some other things that can help you to lose weight: sauna. Being in a steam sauna or infrared sauna, this can help you to lose some of that excess weight. However, it is going to be water weight loss, so you want to make sure you're hydrating really well. A lot of times people will hold on to excess water weight, so this is a great way to get that out, but you want to be hydrated. You don't want it to dehydrate you, so you have to be careful with that.
Right, so you want to detox in the sauna, but then hydrate to replenish what you're losing. Mm-hmm. Sleep is super important. Your body repairs, restores, and detoxes while you sleep. Studies show that overweight adults who got just 1 extra hour of sleep ate less. So I thought that was pretty cool. Sleep is linked to a daily calorie decrease of 270 calories. So that adds up. If you look at that over a 3-year period, that's equivalent to 26 pounds. It's just one more thing that you can add into your regimen to help you be healthier by detoxing, but also helps you lower that weight.
And sleep has so many other benefits, I'm sure, as many of us know. So, it's kind of one of those things that if you get your sleep right, a lot of other things fall into place. Reducing stress is also so important. Like we mentioned, that high cortisol from stress can promote overeating and actually increases that abdominal fat or visceral fat. So we want to reduce stress, maintain your levels of cortisol. And you can do that through supplements, through lifestyle. There's a lot of ways you can reduce stress, but that's going to be part of treating the cause.
Mm-hmm. That's something that you have to look at kind of from a bird's eye view about your life. Evaluate your life. If you're stuck in a high-stress job or a high-stress relationship or something like that, you really have to make the decision to prioritize things in your life. And it won't happen overnight, but it is something to take a look at. Also, reduce your endocrine disrupting compounds. These are chemicals in the environment that affect our bodies, affect how we detox, affect how our hormones work. It affects everything about us. So adopt a clean lifestyle. This could be an entire other show about this, but basically the Clean 15 and the Dirty Dozen, those are found on the Environmental Working Group's website. They have really great information on there about living a clean lifestyle.
Water is also a huge, huge component of weight loss. Drinking enough water, it can help to flush toxins from your body. It can be an appetite suppressant if you drink water before a meal. Oftentimes people are just thirsty and they think they're hungry. So make sure you're drinking enough water. Fill your stomach with some water. It can help you to eat a little bit less. It can actually increase your calorie burning. And then replace any sugary drinks that you're drinking, your double frappuccino, latte, whatever in the morning. Drink water, please. These drinks are not helping you. You're drinking calories.
Yeah, and right away, as soon as you wake up, drink the water. Mm-hmm. Yeah, and if you want to experience any of these weight loss treatments that we've talked about here today, just call us at Naturopathic Physicians Group. We do HCG, we do the IV therapy, we have all of the supplements that we were just talking about. Thank you for joining us today. Please join us next week for another episode of Your Health is Wealth.
Thanks for listening to Your Health is Wealth. Be sure to tune in next week to learn more wisdom on how to live a fuller, richer life. If you have questions about today's show or would like to find out more about the topics we discussed today, call the Naturopathic Physicians Group at 480-451-6161 or email them at info@naturopathicgroup.com.